Bronchopneumonia. Bronchopneumonia is a type of pneumonia where the infection enters through the trachea and bronchi and is aspirated into the alveoli, resulting in widespread patches of consolidation. This X-ray picture shows patchy consolidation which is not restricted to a particular lobe or a particular segment. Note in the X-ray that the mottled opacities are of varying sizes, mainly in the lower zone and more on the right side. This second X-ray shows mottled opacities in the right lower zone in a patient who had received general anesthesia. Aspiration is always more common on the right side, and hence aspiration pneumonias are also more common on the right side. Note the fairly large patches of consolidation, much larger than the miliary tubercles in miliary tuberculosis. The main differential diagnosis of large patchy consolidation is bronchopneumonia, acute pulmonary edema, secondary carcinomatosis, and fungal infections.
For more such stuff, do subscribe to Date with Medicine.